Hello guys, good evening. I hope all are well and good. Okay, so welcome to this one more session of Why Conundrum Part 3. In this Why Conundrum, we'll be dealing with a very important topic. It's regarding an antibiotic, and that antibiotic is an aminoglycoside agent. We have an antibiotic named as aminoglycosides. What exactly are those aminoglycosides? These drugs are the ones which are ending with MYCIN or MICIN. Drugs name which are ending with MYCIN or MICIN, these drugs are named as aminoglycoside agents. Of course, we have macrolides which will be ending with romycin. Those are different set of drugs. Here we're talking about aminoglycoside like streptomycin, kanamycin, netilmycin, gentamicin. These drugs are aminoglycosides. Okay, this aminoglycosides, a very much famous group of antibiotics, will not be effective against Clostridium difficile. Will not be effective against any of the Clostridium species, especially I am talking here about Clostridium difficile. And why is that? Well, that's what the today's topic. Why this drug will not be effective against Clostridium difficile. Okay, so we'll be starting with the why conundrum. Why is this interaction very much famous? Why? Because Clostridium difficile. Why? Because Clostridium difficile is an anaerobic bacteria. Again, when we just put it up, the second name, again, one more why question. And that why question is why aminoglycosides are not effective against anaerobic bacteria. So initially we came up with the single bacteria, which is Clostridium difficile. Now we're talking about the nature of the bacteria, which is anaerobic bacteria. Aminoglycosides will not be effective against anaerobic bacteria. Why is that? To know about that, we have to know what exactly is the mechanism of action of aminoglycoside agents. Let's start with that. We have this aminoglycoside agents. Aminoglycosides, please note it down that it is a single positive charged molecule. Single positive charged molecules means these are ionized drugs. I hope you're hearing it right. I'm talking about ionized drugs because it is carrying a charge. So this will be called as an ionized drug. We have a famous formula, again taken up from our organic chemistry itself. Any molecule, if it is going to be ionized, these molecules would be non-penetrable in nature. These molecules would be non-penetrable in nature. Non-penetrable means it cannot penetrate any cell membranes. It might be a bacteria or it might be human cell. Any different areas, it will not be able to cross any cellular membranes. Now here I'm going to be drawing a particular bacteria, and that bacteria is going to be a gram-negative bacteria. Why is that? Because gram-positive bacteria have got a thicker cell wall. If a cell wall is thicker, how come aminoglycosides is going to be producing its mechanism? Before moving on to that, we have to know one important bit. Aminoglycosides are protein synthesis inhibitors. Protein synthesis inhibitors. How it is going to be inhibiting the protein synthesis? It is going to be binding up with the 30th ribosomal subunit. We have the ribosomes inside the bacteria, like somewhat like this. We have a rough image of that. The upper part has been named as the 30th ribosomal subunit. The lower part will be named as the 50th ribosomal subunit. Aminoglycosides will be binding up with the ribosomal subunit, which is 30S part of ribosomes. So again, aminoglycosides has to bind with the ribosomes of the bacteria, which means it has to cross the cell wall, it has to cross the cell membrane, gain entry into the bacteria and bind with the 30S ribosomal subunit. Which means this drug being an ionized, and we know the formula, it is a non-penetrable molecule. It cannot penetrate the cell wall. That's the reason why as a monotherapy, aminoglycosides will not be effective against gram-positive bacteria also. Okay. Now anyhow, we'll draw one more diagram as I've told. Here it will be effective against gram-negative primarily as a monotherapy. Gram-negative organisms will be having an outer coat. This is named as outer coat. And these are named as pores. Pores are small holes which are there on the surface of the bacteria, beneath which we have the cellular membrane, the thicker membrane lipopolysaccharide layer. And inside is where your 30S and 50S ribosomal subunits are situated. Okay, now we know the formula. Aminoglycosides are ionized drugs. Ionized drugs are non-penetrable in nature. So how come it is going to be crossing up the first barrier, guys? First barrier is very much simpler. First barrier is simpler because we have this outer coat. It will easily cross the outer coat, gain entry into the periplasmic space. Because there is no membranes there is no concepts of penetration. It is easily crossing the outer coat, gaining entry into the periplasmic space. But once it is inside the periplasmic space, it cannot cross the cellular membrane because there is no pores in it. And we know ionized drugs are non-penetrable. It cannot penetrate the barriers. But somehow, this aminoglycoside will gain entry into the cell. Somehow, this aminoglycoside will gain entry into the cell with the help of a particular transporter. We have a transporter situated there. With the help of that pump, this aminoglycoside will gain entry into the cell. And that pump is been named as, this concept is called as oxygen dependent phase 1 entry. This concept is explained as oxygen dependent phase 1 entry, which means this pump will be utilizing oxygen as an energy source, oxidative phosphorylation. Thereby, aminoglycosides will gain entry into bacteria. Once it is inside the bacteria, aminoglycosides will be binding with the 30S ribosomal subunit and tend to inhibit it. Very much simpler. Now, as I've told from the simple one-liner, aminoglycosides are not effective against Clostridium difficile. Why is that? Because Clostridium difficile is an anaerobic bacteria. Why aminoglycosides are not effective against anaerobic bacteria? Because this is the primary mechanism of aminoglycosides. Aminoglycosides will cross the outer coat, gain entry into the periplasmic space. From the periplasmic space, it will not be able to cross the membrane, so it will be utilized in this particular pump, which is utilizing oxygen as an energy source. Now, because it is utilizing oxygen as an energy source, this drug will be effective only against aerobic bacteria. This will be effective only against aerobic bacteria in terms of anaerobic environments. In terms of anaerobic environment, this drug will not be effective, point number one. The second point, in terms of acidic environments, if the area is acidic, this drug will not be effective. If there is accumulation of divalent cations, name some divalent cations which we know. Divalent cations like calcium or magnesium, if there is accumulation of it, this drug will not be producing any response. The last point is in terms of hyperosmolar environment. In terms of hyperosmolar environment, this drug will not be effective. So we have to know under which conditions aminoglycosides will not be effective. We have four concepts to be remembered, very much important for the exams, my dears. The first one is anaerobic environment, this drug will not be effective. Acidic environment, divalent cations, accumulation of divalent cations, or in terms of hyperosmolar environment, this drug will not be effective. Four important reasons behind it. Okay, now we understood the logic. How do we apply it in a clinical perspective? As we know, these areas, these different concepts will be applicable whenever there is a tissue necrosis. Whenever there is a tissue necrosis, these concepts will be applicable. The second point, whenever there is pus or whenever there is presence of or accumulation of abscess, whenever there is an abscess, there is decreased oxygen entry into those areas, anaerobic environment, so this drug will not be effective in those cases. These are the different primary areas where aminoglycosides will never be effective. And also, most importantly, in terms of anaerobic bacteria or anaerobic environments. For example, Clostridium. So be it Clostridium difficile or Clostridium botulinum or Clostridium tetani, in none of these bacteria, aminoglycosides will be effective. Why? Because these bacteria are all anaerobic in nature and aminoglycosides will not be effective in those anaerobic bacteria. Okay. This is the take home point here, guys. This is the important question about the why conundrum of why aminoglycosides will not be effective against Clostridium difficile. Okay, sir. What about gram-positive bacteria? Why is it not effective gram-positive bacteria? Well, that is an important question for one more why conundrum. We'll meet up in one more why conundrum as early as possible. Bye-bye. Good night.